Swayam Prabha. Digital India. Educated India.
Hello dear students, this is Dr. Mona Simalti from HNB Garhwal University, Srinagar Garhwal. Dear students, welcome all of you in this module. Today we are going to discuss about enemas. So I hope you have enjoyed my previous module. So let's quickly see what is there in today's learning outcome. So dear students, after going through from this module, you will be able to know about enemas, different types of enemas in detail, and the procedure for enema, okay, and evaluation parameters of the same. Okay, so dear students, enema, let us introduce to enema. An enema is it is basically an introduction of fluid into the lower bowel through the rectum for the purpose of cleansing or to introduce the medication or the nourishment. So the most important function of enema is to relieve the constipation basically, okay, and the bowel cleaning for and sometimes for the other medical examination purposes also, okay. So different types of enema, they may possess anthelmintic, nutritive, sedative, stimulating effect. So these are the different categories of enema in pharmaceuticals which are given to the patient depending on the condition of the patient. Functions of enema. There are list of functions of enema, say like to stimulate defecation and to treat the constipation, which is very important, and the primary function of enema facilitate in softening of hard fecal matter, and it helps in destroying the intestinal parasites, to relieve the gaseous distension and protect and soothe the mucous membrane of intestine, okay, and sometimes for administration of some medication including anesthesia, and for administering fluid and nutrition, and to relieve the inflammation, okay, and to reduce the body temperature, okay, for medical diagnosis. So these are few functions of enemas. Now classification of enema, moving to the classification of enema. Evacuant enema, simple evacuant enema, medicated uh, evacuant enema, okay, and cold enema. Evacuant enema, we can classify it into two ways, simple and medicated. Medicated, we can describe oil enema, purgative, anthelmintic, carminative enema under medicated evacuant enema, and cold enema. Okay, retained enema, stimulant enema, nutrient, emollient, sedative, anaesthetic enema. Okay, so these are different classes of enemas. Now, what is the purpose of simple evacuant enema? The simple evacuant enema, it stimulates the defecation and treats constipation, okay, relieves gaseous detention and by stimulating the peristalsis movement, and it relieves the urine retention by reflex stimulation of the bladder, and stimulates okay, it stimulates the urine contraction, okay, and it helps in the childbirth. And the one more function of evacuant enema is to clean the bowel prior to X-ray studies, visualization of bowels, and the before surgery. Okay, so to carry out all these procedures, so this is the purpose of simple evacuant enema. So basically, this slide says that simple evacuant enema is used for certain special purpose, either for diagnosis or to carry out the surgical before it is required before to carry out the surgical procedure. Okay, now moving to the a solution used for simple evacuant enema. Soap and water. Okay, soap jelly 50 ml to 1 liter of water. Normal saline. Sodium chloride 1 tablespoon of half liter of water. Okay, basically, and the uh, temperature. What will be the temperature of solution? For adult, uh, it is in degree Fahrenheit 105 to 110, and for children it is 100. Okay, and what is the amount of solution which is used for simple evacuant enema? The amount which is used for adults, it is 500 to 1000 ml. Okay, for children, it is from 250 to 500 ml, and for infants, it is 250 ml or less. So this is the volume of solution used for simple evacuant enema. All right. Now moving to oil enema. Oil enema, these enemas are used when the person is suffering from severe constipation. All right. So before the first bowel movement, after operation on the rectum or perineum, okay, so after some surgical operation, when the patient is needed to pass the bowel first time, this oil enema is used, and for avoiding straining and injury to the sutures or the wound after surgical operation. So it should be retained for half an hour to 1 hour to soften the fecal matter basically. So it is then allowed by application of soap and water enema to open the bowel movement. Solution for oil enema is use olive oil, okay, ginger oil or sweet oil, castor oil, olive oil in the 1:2 ratio, and the amount of solution to be used, it is 115 to 175 ml, and temperature of solution 100 degree Fahrenheit. Okay, this is in case of oil enema. Now moving to the next type, that is purgative enema. So this causes the content of bowel to contact actively and evacuates its content, right? So it irritates the mucous lining and stimulates peristalsis, which causes the evacuation of bowel. So the stretching of the intestine due to this inflow of fluid causes the intestine to contract and leads to the evacuation of bowels. So this is about the purgative enema. Okay. Now purgative enema, the solution used for purgative enema: pure glycerine, glycerine water, okay, and glycerine and castor oil in the ratio of 1:1 ratio, and magnesium sulfate 60 to 120 ml with the sufficient amount of water to dissolve it. Okay, and magnesium sulfate, glycerine and water in 1:2:3 ratio. Okay, so these are the different solution used for purgative enema. So let us quickly see again: pure glycerine, glycerine and water, glycerine and castor oil. Okay, so 1:2, glycerine and water, glycerine and castor oil 1:1 ratio, magnesium sulfate. Okay, and water, right? And magnesium sulfate, glycerine and water again. So these are the solutions used for purgative enema. Okay, Anthelmintic enema is given to destroy and expel out the worm from intestine. So, okay, before the treatment, the bowel is cleaned by application of soap water enema so that the drug comes in contact with the worms and kills the worms and the lining of it cleanses basically the lining of intestine. The treatment is given until the worms are destroyed. So it is anthelmintic enema. Solution which is used, the infusion of quassia. Okay, 15 gram of chips to 600 ml of water. Okay, hypertonic saline solution, sorry, hypertonic saline solution. Okay, sodium chloride 60 ml with 600 ml of water. Okay, so and what is the volume is 250 ml. Next is carminative enema. So these are given to relieve the gaseous detention of the abdomen by causing the peristalsis and expulsion of blood and feces. So it is given as simple evacuant. Okay, it's just simple to uh, to relieve basically the gas uh, distension in the abdomen. So this is carminative generally for kids. No, generally for infants it is used, carminative enema of infants of age below 6 months. Okay, so in case there is a severe problem. Okay, and the solution turpentine 8 to 16 ml of turpentine mixed thoroughly with the 600 to 1200 ml of soap solution. Okay, milk and molasses, that is granular sugar 90 to 230 ml of molasses well mixed with the equal quantity of warm milk. Okay, astringent enema. Astringent enema, it contracts the tissue and the blood vessels, checks the bleeding and inflammation, reduces the mucus discharge and provides the temporary relief in the inflamed area. So it is given in colitis and dysentery, usually in the form of rectal and colonic irrigation. Okay, the solution is allowed to run slowly and return quickly to avoid any distension, pain and irritation of the inflamed wall. So this is about astringent enema. Solution which is used for astringent enema is tannic acid 2 grams to 600 ml of water, alum 30 grams to 600 ml water. Okay, silver nitrate 2% silver nitrate which is dissolved in water and stable water, temperature in solution which is given as hot as the person can withstand. Okay, in case of astringent enema. Cold enema, which is given to decrease the body temperature in hyperpyrexia and heat stroke. Okay, hyperpyrexia, that is sudden when there is a rise in the body temperature and heat stroke. So it is given in the form of colonic irrigation, and the complications may include the hypothermia and abdominal cramps in case of cold enema. Okay, retained enema, an enema that is used to provide the medication, nourishment or anesthetic value. Okay, so it is made from the fluid which doesn't cause peristalsis. Okay, a small amount of solution, it is typically used which is in adult, example from 100 to 250 ml. A retention enema is also used to stimulate the bowels, but the solution for that is used to intended to help in the body for 15 minutes or more. Next is stimulant enema. So stimulant enema, it is given in the treatment of shock and collapse. So it is sometimes given in the case of poisoning, opium poisoning in case like coffee enema is given, black coffee, 1 tablespoon coffee powder to 300 ml of water. Okay, so these are some solution you can see on the slides which are given, and the temperature is maintained at 108 to 110 degree Fahrenheit and 180 to 240 ml. Sedative enema. Okay, sedative enema are used to induce the sleep in the person. The paralyzed, chloral hydrate and potassium bromide, these are few drugs which are used as prescribed by the doctor. Next is emollient enema. Emollient, this is an introduction, basically a solution into the rectum, introduction of a solution into the rectum for the purpose of checking the diarrhea or relieving the irritation on an inflamed mucous membrane. The solution starch opium to 2 ml, 1 to 2 ml is added to 120 to 180 ml of the starch mucilage or rice water. The starch mucilage or alone the starch mucilage 120 to 180 ml, and the temperature is 100 to 105 degree Fahrenheit is used in emollient enema. Anesthetic anemia, okay, it is a retention enema, okay, containing an anesthetic drug to produce anesthesia in the patient. Okay, so you can take any example of anesthetic enema. Nutrient enema. It is a type of retention enema that supplies the food and fluids to the body. The fluid selection, it depends upon the ability of the colon to absorb it, because when we are going to give any nutritive enema, so we have to first see that what kind of nutrition can be given and it can be well absorbed by the colon. So nutrient enema is particularly useful in the conditions like hemophilia, which makes the IV infusion difficult or undesirable sometimes. So in that case, when we see that the IV infusion is not working, so in that case the nutrient enema, it is used for the patients. Solution normal saline, glucose 2 to 5%, okay, and peptonized milk. Okay, now amount which is used 1100 to 1700 in 24 hours, okay, can be given at 4-hourly interval. Now moving to the another. So dear students, till now in this module we discussed the list of different types of enema and their volume, their solution, what are the different solution used for the different types of enema and their volume and the temperature required for them. Okay, now moving to the methods of giving enema. There are 4 types of methods: enema, cannon tube, funnel and catheter method, and glycerine syringe and catheter method, and drip method. So we will discuss these methods in these methods one by one. So let's see first using Enema Cannon tube method. So a tray containing the disposable gloves, water-soluble lubricant, bath thermometer, soap and water, toilet tissues, enema can, tubing and clamps. So these are the requirement for can and tube method. So appropriate size and for the requirements as per the age group of the patient. Okay, so this is the prior exercise before this enema tube and can method. Temperature of the solution in case of adults it is 105 to 110 Fahrenheit, and the amount of solution it is also different depending on the age. In case of adult it is 750 to 1000, adolescents it is 500 to 750 ml, school age is for the patients of school age 300 to 500, infants 150 to 250 ml, and so as you can see on the slide that different different volumes are used for different age group of patients. Now procedure, you have to assess the first condition of the patient, you have to consider the last bowel movement, normal bowel pattern and mobility, and you have to determine the level of consciousness, understanding. You have to explain the procedure to the patient. So this way this is carried out. So next is funnel and catheter method. So small enemas which are to be expelled are given using by using this method, that is funnel and catheter method. The oil is kept warm by placing the container in the bowl of warm water. Okay, so the oil enema is to be retained basically for 2 to 6 hours to soften the fecal matter. So it may be then followed by the soap and water enema to expel the fecal matter. So this is funnel and catheter method. Next is glycerine, syringe and catheter method. A glycerine syringe along with the rubber catheter attached to its nozzles are used. The air is expelled prior to the administration of the fluid. So this method is particularly it is useful for giving enema to children. Last is drip method. So what are the things required for drip method? See, for drip method require a reservoir which can be an enema or a bottle with a cork, tubing attached with the reservoir, okay, drip and Murphy drip and a clamp, a fine catheter, okay. So all these things are needed for drip method. So the procedure, it is a retention enema, administration of the retention enema is done by the drip method. The main purpose is to retain the solution and the main purpose is to retain the solution. Okay, so the flow is regulated and the retention enema is preceded by the simple enema to keep the bowel free of any fecal matter. So this is drip method. So dear students, we have discussed 4 methods of giving enema, and we have also discussed the different classes of different types of enemas in detail in this module. Let us see now few examples. Sulfasalazine rectal enema is used for the treatment of ulcerative colitis, and it may be prepared by dispersing the tablets in 250 ml of water. Okay, and barium sulfate enema containing 120 gram of barium sulfate, 100 ml of acacia mucilage and starch enema to make 500 ml. Starch enema can be used alone or as a vehicle for the other form of medication. So a thin paste is made by triturating 30 gram of powder starch in 200 ml of cold water. Then the sufficient boiled water is added to make the 1000 ml of enema. So this is followed by reheating the preparation. And one more example you can take, the sodium phosphate enema. USP contains 6 gram of biphasic sodium phosphate heptahydride and 16 gram of monobasic sodium phosphate monohydrate in 100 ml. Okay, so dear student, these are the references. I just go through from the references for better understanding of this topic. Now moving to the summary of this module. So dear students, we have discussed in this module about enema. Okay, uh, the introduction to enema, mainly what are the different functions, and I have introduced to the different classes of enema, different types of its uses. Okay, and its classification, what are the solutions used for each class, and the volume and the temperature needed to give the enema of the different classes. Okay, and we also discussed about different methods of giving enemas. There are 4 methods. Okay, so I have not discussed these methods in detail. So this is a homework for you, dear students, that please do read them in detail. So this is about enema, and we have also discussed few examples. So dear student, just remember at least 2 examples of enema to write in the examination. So that's all for this module, and stay tuned for more videos, and thank you so much for watching this video.